International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hi, my name is Erika Linnander, and I'm here to talk with you about a path towards the professionalization of healthcare management. We know that there's growing recognition of the importance of healthcare management in the development of high-performing health systems. But the path by which countries can develop and sustain a professional healthcare management workforce has not been articulated. So we set out to identify a set of themes in the establishment of a professional health workforce of healthcare managers in lower and middle-income countries using a descriptive case study approach. Over the past 10 years, Ethiopia has achieved significant progress towards global health targets, and it's been credited with ambitious investment in hospital quality and access to primary care. To promote these improvements, the Ministry of Health has really prioritized the development of management capacity, with initial emphasis on hospital management. This 10-year arc of national reforms provides a great context in which to study the emergence of a professional cadre of healthcare managers in a lower and middle income setting. So we used a descriptive case study approach that used a historical analysis of the development of the profession in the United States and in Ethiopia, using a semi-structured review of both peer-reviewed and gray literature. Looking across this literature in Ethiopia and the US, we found 5 themes that we think lay the foundation for a professional group of healthcare managers at a national level. The first theme was demand for management expertise, national context that creates this demand. The second theme that we saw in the US and in Ethiopia was the elevation of the management role. The third theme that we observed in the US and in Ethiopia were mechanisms for the creation of professional management standards. The fourth theme that emerged through our review of experiences in the United States and in Ethiopia was an emphasis on the creation of graduate-level educational programs in health management. What we mean by this? We mean well-respected graduate-level educational path that will attract, equip, and sustain a professional cadre of managers. The fifth theme that we observed in the US and in Ethiopia is the creation of a professional association to advance the field of healthcare management. So as you can see, our study aimed to outline key themes toward the professionalization of healthcare managers, and we were able to identify 5 themes. Now, to get this done requires really sustained national level leadership to change the status quo towards a more professional cadre of healthcare managers. Admittedly, this is based on the experience of only 2 countries. We looked at the US and our deep experience in Ethiopia. But it is consistent with sociological theory of how professions develop in other arenas, and we look forward to starting conversations with other academics and practitioners to talk about experiences in other country settings. Now, importantly, we've talked about 5 themes, but we haven't talked about the order of implementation. We think that the timing and the emphasis on each of these themes needs to be tailored to the country setting, but we hope that these themes provide a guide or a blueprint for national level strategy to create a cadre of healthcare managers, a profession that will be able to recruit the country's best and brightest for a high functioning health system. Thank you.